Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another important DABT topic, that is phosphorus toxicity, Phossy job. So let's directly dive into the question. This question is taken from EABT recertification examination from the year 2000 to 2009. So the question is, which of the following toxicant sign symptom pairs are correct? We need to identify the toxicant and the characteristic symptom of that particular toxicant. We have option A, Aminata phalloides, death cap. The signs are diarrhea and delayed jaundice. We have option 2, cadmium, which is a metal, which is listed under ICH-Q3D. Symptoms are anosmia, yellow teeth, kidney damage. Option 3, we have kerosene. The signs and symptoms are cuff and rails. Option 4, we have phosphate, which is characteristic sign is lumpy jaw, which is also called as Phossy jaw. Okay, the right answer will be in the green text, that is E. All options are correct. So, with respect to Aminata phalloides, we already have in detail a video about this mushroom poisoning. Three types of mushrooms are being discussed under Clayson textbook. So I will give the description, the link in the description. You can go back and read about this mushroom poisoning in detail. Regarding second option, cadmium. Cadmium is listed under ICH-Q3D, which is a very important major toxic metal impurity. So we'll discuss in detail about cadmium in another video. And regarding option 3, kerosene. Kerosene as such, it is not listed under Clayson 9th, Clayson textbook, but uh, with respect to kerosene, when I wrote the exam in 2023, question with respect to kerosene has come. So I have made a video on kerosene also, and hydrocarbons related toxicity. So I'll give the link about kerosene toxicity and its symptoms under description. And fourth option, that is phosphate. With respect to phosphate, we have already discussed in our channel under acts and wars. That is particularly that is Phossy job we have discussed. So if today we'll discuss in more detail about all types of phosphorus poisoning. Okay, and let's see what is the explanation which is given by the previous DABT students. Amanita phalloides, which is also known as the death cap mushroom, it causes diarrhea, implied to cause liver damage. Jaundice is a consequence of this impaired damage. Okay, cadmium will affect olfactory neurons. So it is listed under a table. Clayson textbook they have given one table under metal impurities only chapter. So anosmia defined as lack of functioning olfaction. Because olfactory neurons are affected. Cadmium effect of renal tubular cells. So cadmium also causes kidney toxicity. Kerosene, which is a comes under bigger class of hydrocarbons. Characteristic feature is cracking noise from the lungs during inhalation whenever you are exposed to kerosene poisoning. Okay, and last option, this is Phossy jaw. Abscess form in the jaw. Here, the abscess will be formed. It is associated with exposure to vapors of white phosphorus, yellow phosphorus exposure. So we'll discuss in detail about phosphorus in this video. As I told you, phosphorus is not mentioned under Clayson textbook chapter 23, but in the exam uh, in year 2022, based on the memory of DABT previous DABT students, they have given the tentative topic about the phosphorus, Phossy jaw poisoning they have asked in the exam. Okay, so if you look into the periodic table, phosphorus comes under the family nitrogen, phosphorus, arsenic. So phosphorus somehow it will behave like nitrogen and arsenic. So whenever you are reading about arsenic poisoning, what are the things with respect to nitrogen? Some of the characteristic features might be related to phosphorus poisoning also. Okay, now we will see what are the different forms of phosphorus. Name their common derivatives. So we have different types of phosphorus will be there: white phosphorus and yellow phosphorus, which is more toxic, and red phosphorus, which is insoluble form. That's why it is less toxic. In addition to that, we also have black phosphorus. Derivative of phosphorus include aluminium phosphide, zinc phosphide, phosphine gas. So whenever aluminium comes in contact with phosphorus, no, aluminium phosphide, pH3 gas will be released. So one equation we will see about that also. Then what are the macronutrients in the case of plants? If you look into phosphorus, nitrogen, and phosphorus. part of fertilizers, no. So for the plant growth, no, phosphorus is very important. It comes under the class of macronutrients. So you have to read about, whenever you are reading about nutrients with respect to soil. Yeah, last video we have discussed about the circular superfund and soil erosion on. So that's why macronutrient with respect to plants is also important. So keep that also in integration whenever you're reading about phosphorus. Which of the following form of phosphorus is toxic? As I told you, no, white phosphorus, yellow phosphorus, they are more toxic. Why? Because of the solubility, they are readily soluble. Whereas red phosphorus is less soluble, that's why it is less toxic. Black phosphorus is also available, but the exposure to black phosphorus is, and its adverse effects are not well reported in the literature. So let's understand what are the signs and symptoms of oral phosphorus poisoning. So massive intake of phosphorus, that is 1 gram, more than 1 gram. Whenever you are taking orally this phosphorus, no, it will result in fulminating poisoning. Okay, clinical characteristic features are peripheral vascular collapse, and within 12 to 24 hours you can see mortality. 12 to 48 hours you can see mortality. Okay, acute poisoning, no, it is divided into three phases. One is primary phase, secondary phase, and tertiary phase. If you look into primary phase, no, it is due to local irritant action on the GI tract, whereas secondary phase is dormant and it is silent. There is no characteristic features. When coming to tertiary phase, no, due to action of this absorbed poison. So primary phase occurs within 2 to 6 hours of ingestion. It will last up to 3 days. Okay, sometimes the acute poisoning you can see immediate. Initial features include garlic taste. So many questions they will ask with respect to the characteristic diagnostic features. So you will have garlic taste, severe burning sensation in the case of mouth, throat, and retrosternal area, epigastrium, followed by nausea, stomach, and vomiting. So you are taking orally or consuming whenever phosphorus poison. These are the characteristic symptoms you can see. Breath and vomitus are garlic odor. The vomitus and stools are luminous in dark. Phosphorus has similarly to like that of uranium, no. Phosphorus has a luminous, means glowing like property it has, because of which vomitus and stools they are glowing in nature, luminous in dark. There may be hematemesis, that is blood vomiting. Stools may give rise to faint fumes because when still because there is an exothermic reaction whenever this phosphorus is coming in contact with water. That's why you can see faint fumes constituting the smoky and stooly syndrome. There may be hematemesis. The stools may that was about the primary phase. Now coming to secondary phase, phosphorus, no, it is a symptom free phase. So here you will think that after the showing the primary phase symptoms, you will assume that since the patient is not showing any further symptom, you will think that the patient is recovering, but it is a symptom free phase. Patient feel well enough and may last for 2 to 6 days or even more after the subsidence of this primary phase. But what happens immediately? Tertiary phase starts. What is happening in the case of tertiary phase? Whatever the it is due to systemic effects of the absorb. So now whatever the amount of poison which has been absorbed during primary phase, okay, now the poison, the phosphorus poison is entered into the systemic circulation, that is your blood. The original symptoms of primary phase will reappear with increased severity along with manifestation of hepatic damage. There will be tender hepatomegaly, that is liver, it is targeting liver, jaundice, pruritus, bleeding from multiple sites, and anemia. Okay. Finally, hepatic encephalopathy, liver encephalopathy, leading to stupor and coma, oliguria, hematuria, albuminuria, acute renal failure to death. So mortality can be are reported with respect to oral phosphorus poisoning. Chronic poisoning generally it is seen with respect to industrial workers. Okay, after long-term exposure, that is up to 2 to 5 years, that is occupational exposure, not only restricted to oral exposure. It can be dermal inhalation, okay, resulting in a condition known as Phossy jaw. So what is Phossy jaw? We will discuss in another slide. Okay, describe the major actions of phosphorus on our body. So, what are the target organs? Whenever you are reading a certain metal or certain chemical, you should be knowing about what are the target organs. So, here the target, if you look into phosphorus, no, phosphorus will act as a protoplasmic poison or cytoplasmic poisoning, due to which normal metabolism it is distributed and cellular oxidation is severely affected. Mitochondrial, that particular area it is affecting, results in specific. So what are the target organs? Liver, bone, kidney. It is, this phosphorus is causing acute renal failure, and it is also affecting lungs. Okay, so describe the major actions of phosphorus on what are the adverse effects of phosphorus on the liver. Changes in the liver include necrobiosis, which resemble ischemia, prevent cellular metabolism, inhibit glycogen deposition, excess fat deposition, resulting in excessive fatty degeneration and acute liver necrosis. Okay, so this phosphorus is acting as liver toxicant, hepatotoxicant. What are the adverse effects or major action of phosphorus on the lung? So phosphine gas is released whenever phosphorus is coming in contact with water. Phosphine gas is released in the environment, reduces oxyhemoglobin in the blood. So you have to remember about cyanide poisoning, and may prove fatal if more than 20 parts phosphine is present in 1000 parts of air. So this particular phosphine can also bring about respiratory inflammation and develop pulmonary symptoms. So you can see cellular pneumonitis caused by inhalation of this white phosphorus. Next we have what are the major actions of phosphorus on the kidney. So kidney we have seen it causes acute renal injury. So now we'll try to read about what is how what do you recommend use of administration of oil or fat in the case of phosphorus poisoning? Actually, phosphorus, no, it has a characteristic physical feature. Whenever or why oil purgatives such as mineral oils are contraindicated in the phosphorus poisoning? Actually, this phosphorus, no, it gets dissolved in this fatty or mineral oils. No, we cannot recommend oil or fat in the case of phosphorus poisoning. Why? Overall administration of oil or fat, egg, whatever is not recommended because phosphorus is soluble in these fatty oils and would enhance its absorption. So without administration of this oil, absorption, for example, it was 10%. If you administer along with that, in the case of phosphorus poisoning, oil or fat, it will increase the absorption of phosphorus to 30 or 40%. For example, I'm saying oil increases the absorption of phosphorus, hence are contraindicated in the case of phosphorus poisoning. So one question with respect to this also there, how to mitigate the phosphorus poisoning? You should not add oil or fat. Okay, describe the major action of phosphorus on the bone. If bone is the target organ for phosphorus, how it is going to affect it? The major changes which are observed in the bone is called Phossy jaw, that is osteonecrosis of the jaw. Okay, Phossy jaw is a type of osteomyelitis of jaw observed in the chronic cases of phosphorus poisoning. Okay, wherein bone formation under epiphyseal cartilage. Here you have this epiphyseal cartilage will be there. Haversian and marrow canal increases here. These are Haversian canals are there. Okay, results in decrease in blood circulation to the bone, thereby necrosis and sequestration of the bone. Okay, so what has happened in the case of this is an occupational disaster which took place in the Britain during Victoria, London. So there was matchmaking industry where here the women workers particularly they were preparing these matchsticks, and this particular tip of this matchstick was made up of this white phosphorus. So on a chronic in working conditions up to 2 to 3 years, these women got exposed to this white phosphorus fumes, and they started showing necrosis, osteonecrosis of the jaw. Okay, the Phossy jaw, formerly phosphorus necrosis of the jaw, it is an occupational disease of those who work with white phosphorus, also known as yellow phosphorus, without proper safeguards. At that time, worker safety were not there. So these women they revolted and they fought with the particular company for the for having proper working condition whenever they are handling such a harmful chemicals, most commonly seen in the workers in the 19th and 20th century. So this is the mandible showing damage caused by Phossy jaw at the so and so Hunterian Museum. In the severe cases, no, this particular damaged bone was removed from this particular individual. Okay, so as I told in places, they have not mentioned about phosphorus poisoning, but I have seen in Goldfrank's Toxicology Emergency Textbook 9th edition. So in that they have very detailedly explained about the mandibular necrosis, Phossy jaw, and epidemic of this Phossy jaw among matchmakers, the adverse effects they could see latency period of 5 years and mortality rate is around 20%. Okay, it was a very tragic disaster in the case of occupational diseases. So, post this revolt from this young woman, Congress has passed one particular act, that is White Phosphorus Match Act in 1912, which established a prohibitive tax on white phosphorus matchsticks. Okay, what is exactly is happening is this: whenever this white phosphorus from these matchsticks, no, it is coming in contact with air, it is forming pentoxide P4O10. Then it is coming in contact with water and pyrophosphoric acid is formed, which is a chief smoke component. Okay, and this particular thing is causing, whenever you are inhaling these fumes, it is causing Phossy necrotic jaws and fragile femurs, bones. Okay, and bisphosphonic acid, which is a major component in the osteoclast bone formation. No? So this particular pyrophosphoric acid is biologically and similar stereochemically, it is analog of this bisphosphonic acid. Instead of calcium and this bisphosphonic acid and going and binding, this pyrophosphoric acid is going and chelating with calcium. So basically, it is going to interrupt your osteoclast, um, whatever a bone formation cycle is there, no, going to interrupt. Okay, so with respect to management, so another important thing with respect to phosphorus is that it was used as a rodenticide. Okay, so many rat bite commercially at that time were available, in which phosphorus was the major component. Okay, so you have to read with respect to rodenticide, but no longer now in US it has been banned. Now we are not using it is in rodenticide. So elemental phosphorus, whether it is yellow or white, it is yellow, wax paste, fat soluble, and water insoluble. This is very, very important. That's why oil soluble, it will going to enhance the absorption of phosphorus. So whenever you are getting locally exposed to this particular paste, yellow or waxy paste, you will feel local irritation, burns on contact, followed by gastrointestinal distress, liver and kidney damage will be there. Okay, and what is happening is that whenever you are coming in contact with cloth also, this particular thing, it will burn the cloth and it will expose your area and it causes complete necrosis of your uppermost layer, so it is going to compromise your skin layers. Okay, so pause here and read about the smoking, luminescent, vomitous and stool garlic odor. These are the characteristic feature. If a patient comes to an emergency department and is exposed to phosphorus poisoning, how we are going to identify that particular person is by luminous vomitings, stool, garlic odor. These are the characteristic feature. Death is because of dysrhythmias, coma, delirium. These are the cardiac arrest are the after systemic exposure, it will lead to death of that particular patient. Okay, so another important thing that you have to learn with respect to phosphorus is this white phosphorus is used as a munition, like it is used in the case of warfare, and it severely causes dermal burns. So burns require large amount of water irrigation, and once a patient is exposed to this type of dermal burn, chemical burn with respect to white phosphorus, debridement, whatever the damaged skin is there, no, that has to be removed. That is the terminology is called debridement. Okay, and it is also used in the case of suicide attempts also, and majority it is death is due to dysrhythmia. Okay, due to early mortality is believed due to electrolyte abnormalities, cardiac dysrhythmias. Vigilant care is mainstay of this particular therapy. There are some cases, copper sulfate they mentioned, N-acetylcysteine they mentioned, which can be used to mitigate, counteract this particular type of dermal poisoning with white phosphorus, but not much of relevance has been seen with respect to humans. And it has not been shown high treatment, positive treatment with respect to whether it's N-acetylcysteine or copper sulfate. Why burns due to phosphorus cause high mortality than other agents? Absorption of phosphorus through this raw burnt area leads to multi-organ failure. Eventually, it will lead to systemic toxicity, multi-organ failure. Burns due to phosphorus are more dangerous than other burns. When you see thermal type of burns will be there, no? This type of phosphorus type of burning, it takes more time to recovery. Okay, so actually this is been banned, but still Israel used this banned phosphorus-loaded weapons to attack Lebanon. So in recent, you can see currently this is what they used. It burns human skin and failed organs. Here you can see an American soldier who is filling his arms with this particular white phosphorus, which was used during Afghanistan war also. Okay, so name the non-metal toxicity that would occur during some festival in war zone. So in the case of crackers also, white phosphorus is used because of mainly because of the ignition nature. So phosphorus because yellow phosphorus used in the manufacture of firecrackers as well as military ammunition because of this ignition nature. So let's understand the pathophysiology of this particular phosphorus. The mechanism of this dermal injury from the white phosphorus differs. So till now we have studied about how oral phosphorus, primary phase, secondary phase, tertiary phase. Now we'll see how it is affecting when phosphorus is exposed through skin dermal route. White phosphorus it reacts with oxygen and it forms phosphorus pentoxide or other phosphorus oxides. This phosphorus pentoxide, no, it will again react with water and it will form exothermic reaction. You can see high amount of around 177 kilojoules of energy with each reaction it is releasing, producing corrosive phosphoric acid. Whatever this H3PO4 is there, it is highly corrosive. So whenever sulfuric acid, nitric acid, such HCl, corrosive substances is there is irreversible type of skin damage, skin burning will be taking place. Additionally, this phosphorus pentoxide chemically reacts with dehydrate some organic molecules from the cell. They will remove the water. Dehydration of the cell takes place. So the major three mechanisms are there. One is exothermic heat generation, then acid producing, that is phosphoric acid corrosive substance, dehydration. Whatever the rest of the amount from the cells is also dehydrated. So all these three together they will contribute towards tissue injury. Okay, that is the most damaging one is thermal injury by the heat reaction. Okay, so that's why it is this particular white phosphorus cytoplasmic poison or protoplasmic poison. And how can you identify it? By using electron microscopy only we will able to identify how phosphorus is going to cause cytoplasmic poison. Okay, so these are the different places, rough endoplasmic reticulum, where it is going to and how it is going to cause initial nuclear or mitochondrial damage. When compared to red phosphorus, no, it is less toxic. As I told you, why? Because it is less soluble and it is majorly it is going to cause GI distress and it is less toxic when compared to white phosphorus. So as we have seen that it is used as a munition, means it is used in the case of war also. So what exactly is happening is that white phosphorus it splatters whenever from that particular explosive this white phosphorus is released, it splatters and it can penetrate your cloth and it will cause damage, permanent irreversible type of skin disruption takes place. Okay, exacerbates burn area. Dermal penetration may be partially due to lipophilicity. Lipophilicity of that particular nature of that particular white phosphorus. It will compromise your dermal layer because your skin have various layers. Skin has various layers. Percutaneous, subcutaneous layers will be there. They get disrupted. The smoke produced by burning white phosphorus, it is going to damage your eye also. That is irritating to the conjunctiva and mucosa of this oropharynx as well as your lungs. Large burn will end up with systemic illness, that is electrolyte imbalance, liver abnormalities. It also leads to cardiac dysrhythmias, 12 to 15% body surface area. If in the case of rat it is burned, it will lead to 50% of the time it led to mortality of this rat. Okay, so similarly, Healing is very difficult when compared to thermal burns, no, very time taking and prolonging. So these are some of the important questions with respect to phosphorus, with respect to analytical this thing. So immediate symptom upon oral ingestion is emesis and hematesis, important thing. And how we are going to diagnose phosphorus poisoning is vomitus and stomach contents, garlic like odor of human content you can see in the case of phosphorus poisoning. So stop here, you can read about these important questions, and towards the end we'll discuss some of the AACT, that is American Academy of Clinical Sciences question of the day. So in that they have asked questions like white phosphorus is potentially dangerous material often used as munition as a component of fireworkers and may also be found in some insecticide fertilizers as well as rodenticide. We have discussed it was earlierly it was used as a component in the rodenticide. So that's why, see, they have integrated all the questions, fertilizers, because it is a macronutrient. And rodenticide, as I told you, rat bite, this is an example. Uh, Components of the fireworker, that is munition. So the characteristics, so what are the physicochemical characteristic of this particular chemical? Means phosphorus. Primarily related to ability to cause injury, characteristic of most concern is auto ignition temperature. Whenever this phosphorus is coming in contact with the oxygen, it automatically it will start burning. Okay, why? The temperature at which combustion takes place without any ignition source, you need not need any or it will self burning, it will be there. Auto ignition temperature for white phosphorus is 86 degrees Fahrenheit. Okay, so how it is going, the reaction, everything we have read. So in wounds, particles of white phosphorus continue to oxide. If you don't remove, that is what debridement I told, if you don't remove the damaged or phosphorus particles still remaining on your this thing, no, on the exposed area, it will still start continue this reaction. It continue to oxidize until debris neutralized or consumed, producing a yellow flame with white smoke. Okay, so you can stop here and see how the phosphorus released from this particular ammunition. Then what gas is liberated when aluminum phosphide or zinc phosphide interact with water? So as I told you, know, this is an active pesticide. Whenever aluminum phosphide comes in contact with water, phosphine gas is liberated. Okay, that is this particular pesticide, that is aluminum phosphide or zinc phosphide. It is used to treat grain stored in closed spaces. That's why it is used as a fertilizer, as a rodenticide. Getting my point. The next question is with respect to yellow phosphorus ingestion. What are the clinical indicators? So primarily based on industry, because we cannot identify whether it is yellow phosphorus poisoning. We cannot, based on patient history only we can identify. Diagnosis is often presumptively and primarily based on history. There are some places where you can see blood levels also. Phosphorus is not going to show anything in the blood. Only thing is that garlicky odor or luminous of vomitous stool may be helpful. Smoking stool syndrome it is called. That is faint fumes emanating from the stool are called smoking stool syndrome. That is one of the characteristic features where the emergency department physicians can identify. With respect to Phossy jaw use US occupational cohort, we have discussed in detail. So one question with respect to mandibular osteonecrosis also they have asked. Okay. Then another question is with respect to white phosphorus only. We are going to identify. So, so question was what is white phosphorus? How might contact with chemical result in systemic injury? Okay. So, on contact with exposed skin, white phosphorus produces painful chemical injuries. Okay, high lipid solubility of this phosphorus extended to deep tissues, subsequently delayed wound healing. Systemically, later in third phase, when it gets absorbed, it causes multi-organ failure. It is going to damage your blood cells. That's why you have blood vomitings, kidney, liver, and heart. That's you can see dysrhythmias of heart. You can see. Recommended initial emergency treatment of white phosphorus burns is, first of all you have to cool the patient. You have to remove that whatever the debridement is, damaged tissue you have to remove. Put it in underwater. See, the recommended emergency treatment of white phosphorus burns include careful removal of the protected storage of the patient clothing, continuous irrigation with water. Okay, sterilely you have to debride and properly disposed of whatever the fragments are there still there on the skin. Use of wood lamp, this is the wood lamp. Because of this luminescent nature of this phosphorus, you can identify if there is any small amount of still exposed area if phosphorus is there. By using this wood lamp, you can identify the retained particles containing white phosphorus. You can use, as I told you, acetylcysteine as copper sulfate 0.5% can be used, but it has not shown too much of positive results in the treatment. So that was about the phosphorus poisoning. We read in detail about white phosphorus, yellow phosphorus, red phosphorus, its solubility, ignition temperature. What are the characteristic symptoms with respect to oral absorption? Phossy jaw, occupational hazard in the case of Britain. Okay, matchstick girls, it is common well known as. It is used as a rodenticide. It is used in the case of immunization because of dermal irritant, lead to systemic toxicity, and leads to dysrhythmia also. Mortality is also there. So that was in detail about phosphorus. So thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. All the best for your exam.